What if you are given a deadline to live today? What if I told you I give such deadlines daily? When life gives you a deadline, how do you rise? I see people rising every day. That is the great honor for me as a doctor. Cancer is scary. What comes to your mind when you hear the word cancer? For a disease that takes more than 10 million lives each year, what do you think about it? It evokes images of pain, hair loss, suffering, or for that matter, death. The families come to me with deep anguish and hopelessness, even as I struggle hard to declare the diagnosis of cancer. Every day, I meet people in deep pits of despair, a seemingly hopeless fate, but they choose to rise from depths to heights, even as they dare to hope. Let me introduce you to one such hero, Suhasini. Suhasini was caring for a 3-month-old daughter when she was diagnosed to have non-Hodgkin's lymphoma stage 4, a type of cancer of the white blood cells or the lymphatic system. She just came to me and asked me one question: will you give me 10 years to live so that I can raise my daughter enough so that she can take care of herself? As if I had a say in the matter. Even as you see there in the picture, few weeks ago, she celebrated half-saree function for her daughter. Against all odds, not only she fought to be a conqueror, she raised her both children today. There are some people who have resolve in their intestines and gumption in every cell that nothing can stop them from soaring. To me, to declare a diagnosis of cancer is challenging. But most of my patients face them bravely. Some go on to remission, and others ponder on the life after, but almost all with their heads always held high. Geeta Suresh was the mother of 2 adolescent girls, was diagnosed to have cancer of the uterus, a rare type called carcinosarcoma. We performed robotic surgery on her. Within a short span of time, it recurred. The family was in deep pain, but she fought hard, she fought bravely, and close to a decade now, she is disease-free thanks to the support of the family and even as they explored every option available for care. Let me share with you a story of a young lady who had a cancer of the esophagus. A major surgery had to be done. It took almost 6 hours for us to complete the surgery. I was a relieved man. Within 3 days, she started developing breathing problems. It so much so happened that we gave up as we connected her to a ventilator. The team was in deep shock. I was in really deep hopelessness. I just told her, keep fighting. We're all doing the best for you. And just reassured that we're all praying for you as well. Finally, we called the family members and counseled them that it's better to discontinue the treatment. Even as we gave up and released her to be carried in the ambulance, possibly to be buried the next day as we disconnected from the ventilator in the ambulance. In a career that has seen much, it was a tragic day for me. After 1 week during my regular visit to a medical college at Narkatpalli, about 70 kilometers from Hyderabad, I heard a voice. When I turned, to my surprise, it was the same lady with the chest tubes in. She shouted, "Sir, I'm your patient, I'm still alive." A classic case of rising from the deathbed, even as the medical fraternity had given up. That changed my perspective, friends. That's when I had a desire to focus on the holistic care for cancer. Today, my patients are my heroes. They are my inspiration. They taught me perseverance. They taught me resilience. Even as the whole world had given up on them, they fight and they become the conquerors. I come from a family of farmers. Dear friends, rising is innate to us. What's holding you? Even as I had humble beginnings, a small village kid, our village doesn't have a proper road connectivity even today. I was a go-lucky kid going to this school about 3 kilometers away from my home. My journey from rural India to this stage is truly a transformational one. At each stage of my journey, I had 3 things that fueled me: a constant pat of encouragement, a constant pull from above, and a constant push from behind helped me to be where I am today. I used to handle sickle well in our farm. I was good at cutting the grass, even as we had to feed the cattle. On a particular day, I was helping my parents in the field, and I happened to accidentally cut the frontal and the rear end of a cobra, along with the other grass that I had held. That's where my journey as a surgeon began. You see, I've always been good at cutting. There was an article in New York Times which says like this: your surgeon childhood hobbies may affect your health. Especially the present generation is hooked to the screens without the fine motor skills exposure. When you happen to meet your surgeon next time, you can check out his hobbies in childhood. Nevertheless, the turning point in my life was when the government of India introduced the Navodaya Vidyalayas for the first time in the country. I wanted to appear for the entrance exam, but didn't have the guts to stand up and say that I will write the exam. The teacher selected 5 of them, out of which 3 were disqualified. With a final list of 2 students who will appear for this entrance, the teacher was about to leave the classroom. Then enters a gentleman by name Jayappa into the classroom. He looks at me and says, "Why not this boy write the exam?" And the rest is history. If you look at my journey, it is from sickle to scalpel to handle the most complex surgeries in the human body. And nowadays, thanks to the robotic surgery, scarless surgery, minimally invasive surgery, that is my journey. You can rise from any background. I recollect Mahesh, who was a nicotine abuser. He was addicted to tobacco chewing since he was 10. He presented to us with an advanced oral cancer. Even as he had 3 children at the age of 30, he came to us. We performed a radical surgery for him, but within no time, we lost him. I was in deep anguish and helplessness, even as the family struggled to take the dead body back home. This was a preventable cancer. If not, it could be detected early. This gave an ideation that I should do something in the space of prevention and early detection. This gave birth an idea or a seed for Grace Cancer Foundation. Along with few other like-minded doctors and police officers, we founded Grace Cancer Foundation in the year 2013 with a singular vision to alleviate the cancer burden in the society. How do we do that? We would achieve that through 4 pillars: cancer education, early detection through screening, treatment and rehabilitation, and cutting-edge research. Most of you may not be aware that majority of the cancers can be prevented. Some of you seated in this audience may not know that there are 2 vaccines: human papilloma virus vaccine for cervical cancer and hepatitis B virus vaccine for liver cancer, to prevent 2 cancers. In my practice, Majority of the cancers I see are in advanced stages where outcomes are poor. If you look at the causes for cancer, 70% of them are because of lifestyle and environment. If you detect cancer early, we can cure the disease. 1 in 5 men and 1 in 6 women in their lifetime have a chance of getting cancer. If you look at top 5 leading sites of cancer, breast, lung, mouth, cervix, uteri, and tongue, all of them are preventable early. If not, you can detect them early. Why the outcomes are different in different geographies of the world? It is because of lack of awareness and lack of access to early detection. If you look at the risk factors for cancer, I say 4-4-80. There are 4 risk factors which are modifiable: tobacco chewing, unhealthy diet, lack of physical activity, and excess consumption of alcohol. They lead to 4 non-communicable diseases like cancer, diabetes, cardiovascular, and respiratory, accounting for 80% of the deaths. Is there not a cause? Why a preventable cancer is not prevented? That's how we started making an impact and trying to reach out to the rural areas to raise the awareness. Even as we began to make an impact, something tragic happened in my life. A tragic accident took my mother's life, leaving me shattered and disappointed. Even as thousands queued up to pay their last respects for her body kept in the casket, I was moved because in a small village, she left a great legacy. I was moved to the idea that I am in a much better privileged situation to reach a larger goal than what she did. This gave a new direction to the foundation. Grace Cancer Foundation was no more an organization or an institution. It became my life's mission. Out of deep agony, this new direction came into us. My mission to make sure that cancer doesn't have the power to take away lives. Look at this picture. We started a new program called Mobile Cancer Screening Campaign. Even as we began to go to the rural areas to not only to raise the awareness, but to do the early detection through screening, we were able to touch thousands of lives. Rajava was 40 years old. She attended a cancer screening camp in a small village near Nizamabad. She was diagnosed to have a cancer of the breast, stage 1, thanks to the mammography done in the mobile bus. She was operated on without requirement even for chemotherapy or radiotherapy, and she is happily taking care of her 4 children today. For her, screening was not a priority. Breadwinning and taking care of the family was. That's where we go to their doorstep to help them participate and get the awareness and detect cancer early. If you look at the impact of Grace Cancer Foundation, we've been able to reach about 10 million lives across 120 countries in the last 1 decade. For the past 14 years, it has been my journey from Hyderabad to a place called Nizamabad on every Friday to visit this cancer center you see in the picture on the right-hand side. We made this journey to bridge the gap in the cancer care across urban and rural India. A comprehensive cancer center was established in this place to provide the state-of-the-art treatment facilities. You see their outdated cobalt machine on the right-hand side you see was replaced with the state-of-the-art linear accelerator for giving advanced radiotherapy. Today, the center is catering to 120 patients every day. This is the only cancer center for 5 districts in North Telangana. To make the impact of Grace Cancer Foundation larger, we launched the Global Grace Cancer Run in the year 2018. This is not just a run, but a global awareness drive. Even as you see here, every single person who runs is going to support someone in the rural area for cancer screening. If you can understand, lifestyle is a significant risk factor for cancer. One-third of cancers can be prevented by change in lifestyle. One-third can be prevented by early detection. So to drive this message across, the run has been launched for the last 4 years, and this year it's going to be the 5th edition. Every single person who is running is able to transform the life of someone who is in rural area. He could be close to you or far from you. Like-minded individuals across the world came together again, and in the couple of years ago, we started Global Grace Health, a non-profit in the United States of America, to support Grace Cancer Foundation and to take this mission across the rest of the world. This was the run, in some of the participants you can see are in Russia. My life's dream is to make this world cancer-free. I hope that is my legacy. To be able to give hope, you don't have to be a clinician. Every day I give hope. I help people rise. You can too. Today, the world is heading towards a tsunami of non-communicable diseases, including cancer. The only logical path is prevention, early detection, and reversal of the disease. The movement has begun in India and gone global. Would you join this movement? Each of us have a choice to leave a legacy. Each of us have a choice to make a difference. It all depends on what you choose. What is your legacy? Thank you. Thank you. Thank you. Thank you.